5 on Your Health tonight. A number of deadly crashes involving cars and pedestrians just within the last 24 hours. A person was hit and killed in Boston South End this morning. Another killed in Jamaica Plain last night. And a third person seriously hurt in Franklin this morning has now died at the hospital. October is Pedestrian Safety Month.
And joining us now is Dr. Ali Raja, the Vice Chair of Emergency Medicine at Mass General Brigham. Thanks so much for joining us. All right, now, you get the call. A person is hit by a car. Paramedics have one patient on the way. What is your first thought?
Great question, Shana. You know, when we hear that a pedestrian's been hit by a car, we immediately prepare a trauma activation. So that means we clear one of our trauma bays out and we bring the patient right in from the ambulance. When they get there, there's a team of about 8 to 10 people. We've got techs, nurses, emergency physicians, surgeons. We're all ready to work on the patient in parallel. And our first focus is making sure that they don't have life-threatening injuries. But I got to tell you, it's a really organized, rapid response that puts every resource of the hospital on standby right away for them.
All right, Dr. Raja, these situations, as you know, can be very scary, not just for those directly involved, but anybody who witnesses what happens, other people just walking down a street. Is there anything that bystanders can do that would actually be of help at a scene like that until first responders get there?
You know, it's a great question, Ben. For the people who witness a crash, it can really be overwhelming. But the first simple thing to do is just call 911 so that trained responders can arrive as quickly as possible. I have to tell you, there's plenty of stories out there where people thought somebody else was going to call and there was a delay in EMS response. So make sure you call 911. Stay with the victim, talk to them, ask them their name, and keep them calm and alert while help is on the way.
And Dr. Raja, in general, should a bystander move or not move a victim?
In most cases, Shana, no. Unless the victim's in immediate danger, like lying in the middle of an active roadway or near a fire, it's usually safer to leave them where they are. We can sometimes worry about patients like this who have been struck by a car having serious neck or spine injuries, so we don't want to move them unless we have to.
And what about, Dr. Raja, if the person is unconscious?
Ben, that can be a little bit more serious. So if a person's unconscious, the first thing is to check whether they're breathing and if they have a pulse. If they're not breathing normally, or if you don't find a pulse, start CPR immediately if you know how. And remember that the 911 operator, she or he can talk you through it if you need to. But I have to tell you, and I'm glad you guys are talking about this, this should be a reminder to all of us that if you haven't had CPR training, if you haven't had stop the bleed training, which is to help people who might be bleeding, please do so. A few hours of training can help put you in a position to really help people before EMS crews arrive.
Great advice, news you can use. Thank you, Dr. Raja.
Thank you.
Thanks, Shana.